I'm called Dr. Baifa Arwinyo. I am an obstetrician and gynecologist working with Ministry of Health. I'm at Gulu Regional Referral Hospital. Like I mentioned earlier, I'm an obstetrician, gynecologist. I deal and work with pregnant women and other conditions affecting the reproductive life of other women. So today we are going to talk about bleeding during birth and bleeding after birth. What is bleeding after birth, to be specific? Bleeding after birth, in our language, we call it postpartum hemorrhage. So we are going to talk about bleeding after birth today. I would like us to understand what is bleeding after birth. After all, every woman bleeds when they are delivering. Why are we talking about it today? So the bleeding after birth we are talking about today is excessive bleeding after birth, which we call postpartum hemorrhage. Postpartum hemorrhage is when a mother bleeds excessively following delivery. And what is excessive in this case? Excessive means bleeding more than 500 mils of blood. 500 mils is equivalent to 2 mugs. Bleeding more than 500 mils, bleeding more than 2 mugs of blood if we must collect it together. So when a mother bleeds 2 mugs of blood and above following a normal vaginal delivery, we say she has bled excessively. So we term that as postpartum hemorrhage. How about a mother who delivered through cesarean section? A mother delivered by cesarean section, when they bleed an amount of blood that is more than 1 liter. 1 liter is equivalent to, we know 1 liter, the small jerrycan of cooking oil, that 1 liter jerrycan. If you bleed that amount of blood or more, then we say this mother has postpartum hemorrhage. That is what we are talking about today. So we can only define that when we are able to measure the amount of blood. What if, in case we are unable to measure this amount of blood, how would we say this mother has bled excessively after delivery? So then we say, when a mother bleeds any amount of blood that leads to deterioration in her clinical state, that makes her condition worsen, then we say that mother also has postpartum hemorrhage, regardless of how much she has bled. But if I bleed after delivery and my condition changes for the worst, I was sitting up normally before I delivered, but then after I have delivered, I am unable to sit because I am dizzy, because my blood pressure is too low, then we say Mother X has bled excessively. That's what we are talking about today. Why must we talk about postpartum hemorrhage? Why must we talk to you mothers about postpartum hemorrhage? Reason is because it is the leading cause of mothers dying due to pregnancy-related conditions in our country and in Africa at large. It's the leading cause of death among pregnant women and among women who have delivered. The other reason why we are talking about it is that every 10 women who come to deliver, around 3 of them will suffer this complication of excessive bleeding after birth. So it is a problem that is here with us. So that is the reason why we want to talk to you about postpartum hemorrhage today. So if it is such a problem among our pregnant women, it's the leading cause of death, then we ask ourselves, what causes this excessive bleeding after birth and during delivery? The main causes of bleeding after birth have been classified into 4 different classes. Medically, we call them the T's, okay? The first one is tears. When a mother sustains tears in the birth canal during the process of delivery, that tear could bleed excessively to cause postpartum hemorrhage. And then 2, the second cause of postpartum hemorrhage, we call it tone. That's the second T. That is, when we deliver, we expect the uterus or the womb to contract to help arrest excessive bleeding after birth. But then when it fails to contract and arrest that bleeding after birth, because remember, when you're pregnant, your tummy is very big. And then after the baby has been delivered, the placenta is out, the uterus becomes very small. It happens like that because it contracts. So in some women, that process does not happen. It still remains as big. So it fails to undergo the natural process we expect to happen. So that could cause excessive bleeding because the blood vessels have not been closed off. The third cause of bleeding, excessive bleeding after birth, is when we have tissues, parts of the placenta, clots which have been retained in the uterus following delivery, when they are not expelled completely. Okay? So there is what we do after the baby has been delivered. We deliver the placenta and then also try to push out any clots that could have remained. So just in any case, some of those clots remain or tissues of the placenta remains, they will inhibit the normal contractile process of the uterus from happening, so hence causing excessive bleeding after birth. The last T, we call it thrombocytopenia. That's medically, however, it's basically failure to clot normally. When your blood fails to clot, you end up bleeding excessively. So some women come with that abnormality in their clotting. So instead of achieving the clots after delivery, their blood fails to clot, so they continue to bleed. So those are the causes of bleeding after birth. So now that we know the causes of bleeding after birth, how do we know that this mother is going to bleed excessively after birth, or the other one will not bleed? We have what we call risk factors. Risk factors are things which are most likely to cause Mother Akelo to bleed and Mother Abe does not bleed. So the risk factors are clear. It is what we would like you mothers to know. One of the risk factors is any mother who has ever bled excessively in previous pregnancies. So if you know that in your last pregnancy you bled excessively, you need to inform your midwife, the nurse attending to you, or the doctor that, you know what, doctor, nurse, the last baby I bled excessively and they even transfused me. So that we know that this mother has got history of bleeding before. She's most likely to bleed even today with this pregnancy. Okay? And then the second risk factor is mothers who have carried pregnancies more than 6 times. For us, we call them multigravidas. If I've carried pregnancy 6 times and above, this is my 6th child, my 7th, my 11th pregnancy, the risk of me bleeding excessively during this delivery and after delivery is much higher than a mother who is carrying a pregnancy for the first time or for the second time. So 6 times and above number of pregnancies is a risk factor for postpartum hemorrhage. So such mothers, even at the health centers, we tell the midwives, make sure such mothers deliver in a facility that has a doctor to attend to the postpartum hemorrhage in case it arises. Okay? The third risk factor, any condition in pregnancy that leads to excessive enlargement of the uterus. We all know, we've all been pregnant mothers, you know that. When we are pregnant, of course, the uterus enlarges, but there are some pregnancies where it enlarges beyond the other pregnancies. Okay? So what conditions are these? One is mothers who are carrying big babies. Okay? A big baby is a mother carrying a baby of 4 kilograms and above. Okay, that can be confirmed by scan or even from antenatal clinic, and the midwife tells you this baby feels big. Okay, then we have mothers who are carrying more than more than one baby, twin pregnancy, triplets, or carrying 4 babies, quadruplets. So when you have 2 babies, definitely the uterus will expand bigger than a mother that is carrying only 1 baby. So in this case, because of the excessive enlargement of the uterus, after delivery, this could interfere with the normal contraction that we expect of the uterus. That's what we would call atony. The uterus may fail to contract normally. We call there is atony, which is a cause of postpartum hemorrhage. So such mothers, we want to write on their cards and say, big baby, twin pregnancy, deliver from a health center where there is a doctor or there is an operating theater. In case of anything, we are able to attend to you timely. Yes, the other risk factor for excessive bleeding after birth or postpartum hemorrhage is anemia in pregnancy. Having inadequate blood during my pregnancy is a risk factor for me suffering excessive bleeding after birth or postpartum hemorrhage. We expect that every pregnant woman has enough blood to carry her through pregnancy, and then also naturally the body prepares itself for that minimal bleeding after birth. So if during my pregnancy I already have low levels of blood and then I bleed during delivery, my condition is most likely going to worsen after delivery. So we expect that every pregnant woman has enough blood levels. Medically, we say not less than 10 grams per deciliter throughout pregnancy. So I am safe with the minimal bleeding we expect during pregnancy. So anemia in pregnancy is a big risk factor to postpartum hemorrhage, so we need to prevent that. And then we also have mothers who are carrying a baby that is not alive. Okay? Mothers, they say, my baby is not breathing. From scan, said baby is dead. So such, we call it IUFD medically. So there is a complication that arises from a baby that is not alive, which affects the normal clotting process of blood. So such mothers fail to achieve normal clotting after delivery, what we call DIC medically. You'll hear the midwife say, there is DIC here. So that means your clotting process has been affected by the fact that, you know, I was carrying a dead baby and delivery process took longer than usual, so it's affecting clotting process of that mother. So that explains why when you come with a baby that is dead, part of the preparation before we deliver you, we are making sure we have blood to give you in case we suffer postpartum hemorrhage with such a case. And then also the other risk group are mothers who bleed during pregnancy, what we call antepartum hemorrhage. Mothers who have ever been admitted for bleeding during pregnancy, especially pregnancy that is more than 7 months, are at risk of getting bleeding after birth also. So such mothers, we consider them high-risk mothers. So when they come to deliver, we put an alarm on your file and say she had APH, so we need to be prepared when we are conducting your delivery to salvage any excessive bleeding after birth that may occur. Okay, so those are the risk factors basically that we need to identify during the antenatal care sessions that we have with you. Now that we know the causes, we know who is at risk. Mothers, now we know ourselves, okay? So now, how can we prevent this from happening? Because we know when it occurs, the chances of dying are very high. Much as at the hospital level, we try our best to prevent death. But then we want to prevent. Prevention is better than cure, even for postpartum hemorrhage. So how can a mother who is pregnant prevent herself from getting excessive bleeding after birth? First and foremost is a pregnant woman must initiate antenatal care early. Early means as soon as I miss my period and I suspect I could be pregnant, I am running to the health center, to the hospital, to confirm that I'm pregnant, and then I start antenatal care. So timely initiation of antenatal care is key in prevention of postpartum hemorrhage. And when you come for antenatal care, the team in the health center or hospital are going to give you a package for antenatal care. And one of them is risk assessment. Okay? They're going to ask you questions such as, have you bled before during previous deliveries? Then you say yes. Then we know this mother is at risk. We need to keep an eye on her. Okay? And then, so that is part of risk assessment. The other things that we do at your antenatal care visit, the earliest you've come, is to check your blood levels. Some women who know English already say CBC, okay? So we'll do your CBC, we'll do your hemoglobin. We want to know how much blood are we entering this pregnancy with, okay? So that if it is low, we need to do something about it, okay? So we check your blood levels at the first antenatal when you come. And then the other thing that we do in antenatal to prevent excessive bleeding after birth is we give you iron supplements. The iron tablets, folic acid, okay? We give you throughout pregnancies to keep your blood levels above 10, okay? We also give you health education on how to keep blood levels at par. Good nutrition, balanced diet, sources of iron. You can only hear this during antenatal care sessions. So mothers should start antenatal care early. Above all, we do risk assessment there and then advise you on birth preparedness at antenatal care clinic. That is very key in prevention of postpartum hemorrhage. Second is birth preparedness and complication readiness on the side of the mother. Okay, as a pregnant woman, I need to be birth prepared right from the time I know that I'm pregnant. So that means I know where I am going to go when labor starts. I know where I will run if I see any abnormality with my pregnancy, including bleeding. Because when you come early, we prevent complications such as postpartum hemorrhage. This is only possible when the mother is prepared for the birth of a child. And then when the mother is prepared for any complication that may arise. Part of the complication readiness among mothers that we expect during the birth preparedness sessions is, does this mother know the nearest facility to go to when she is in danger? And then two, does this mother know a relative or a friend whose blood group is compatible with hers? Just in case we need to transfuse you, and by bad luck that day, the blood bank has run out of blood, which may happen, we are going to reach out to that person who is already informed that I may need you. That is part of the ways of preventing the problem, okay? And then the other ways we prevent postpartum hemorrhage is to, at the facility level, when you come to us to deliver in the maternity, the midwives and the doctors are emergency ready also, okay? So when you come in with your antenatal card, you've been in Onyama Health Center 3, attending all your antenatal care visits, then you come to Gulu Regional Referral or to Mulago to deliver. So we will look at your card because you started antenatal early, and then the midwife who attended to you did a good job and said, this mother has ever bled before during her delivery. So this will alert the doctor at the hospital where you are now, okay? So that before you even deliver at the hospital level, we will make sure we are ready for this monster postpartum hemorrhage in case it comes. So we have preventive measures we will put in place as we monitor your labor, as we deliver you, to prevent postpartum hemorrhage from occurring again in this mother. So in that manner, we have prevented postpartum hemorrhage. When we attend delivery, we encourage that you deliver at the health center or at the hospital. That is another way of preventing excessive bleeding after birth. You should deliver in the hands of someone who is skilled to attend deliveries. That is a midwife or a doctor or a nurse with a training in midwifery. Those are the skilled birth attendants we know. You're not encouraged to deliver at home if you want to prevent postpartum hemorrhage. So you should deliver in the hands of a skilled personnel. So this is discouraging mothers who say, let me try at home. After all, my other 6 babies are delivered at home, even 7 is fine. So that is a risk factor for postpartum hemorrhage. So now we know how to prevent it. Let's prevent it other than cure it. Because the regional blood bank has blood, yes, but not so much blood to help for something which we could prevent. So mothers, you play a very big role. 90% of the role is in the hands of the mother to prevent postpartum hemorrhage. We only contribute 10%. We only come in when it has happened. So please prevent it as much as possible. So finally, what can go wrong when you've suffered postpartum hemorrhage? Complications, what can go wrong? One of them is you could die. Like we say, it's the leading cause of maternal death, leading cause of mothers dying. You could die, okay? So we don't want a mother to die from bleeding after birth, so let's prevent it. Number 2, if our mother survives, what can go wrong? One of the complications is reduced milk production. Some mothers lose breast milk completely because when you bleed excessively, the excessive bleeding affects the part of the brain that is responsible for milk let down, okay? So such mothers will try to feed their baby 1, 2, 3 weeks, milk is not coming. Those are some of the complications of mothers who bleed excessively after birth. We don't want that to happen to your baby. So let's prevent bleeding after birth. The other complication is infections. Because when you bleed excessively after birth, the low blood levels in your body is not able to fight against any infection that comes in after delivery. So you're at risk of getting infection and you stay longer in hospital, yet your family needs you. The other complication of excessive bleeding after birth is the fact that you will end up being transfused, okay? We do not want you to be transfused. What the Lord gave you is enough for you. There are risks involved with blood transfusion. So let's prevent to avoid being in a scenario where we have to add for you blood and we have to look for the blood to give it to you. So we need to prevent postpartum hemorrhage as much as possible. Yes, the other complication is infertility. Infertility is failure to conceive. One of the things that we may do in the hospital setting or health center during the process of managing postpartum hemorrhage, excessive bleeding after birth, one of the things that we may do when we can no longer control bleeding is to take out the uterus, which is a source of bleeding. It is usually the last step that we do after trying all other measures of controlling bleeding. So at one point we say we need the mother. Let's take out the source of bleeding, which is removing the uterus. So that means we are putting an end to you ever having a baby. That is a very big complication. So why must I not prevent something which puts my life at risk of having the uterus removed and ending up with only one baby just in case that was the only child that I had? So that complication is something that is going to affect your social life and marriage as well. So I would rather do the needful to prevent postpartum hemorrhage so I don't reach this point. I have the number of children that I desire as a family. Lastly, the other complication of postpartum hemorrhage is prolonged hospital stay. Mothers who delivered and bled 200 mils will go home the next day, go and attend to their family, less money spent. But when you have excessive bleeding, we want to keep you for up to even 1 week, even 3 weeks, depending on how bad it was. And that is expensive on the side of your family. So it is much cheaper to prevent excessive bleeding after birth than curing it. And losing a mother from postpartum hemorrhage is such a big deal. We can't have a family without a mother. Mothers, you know, you've lost neighbors, you've lost family members, you've lost mothers. You know how those children suffer. You know how the newborn is going to suffer. So today, I want you to know that we have to fight together with you against this monster of postpartum hemorrhage, so we prevent it and we have no mother die because of bleeding related to pregnancy and childbirth. Thank you very much. Thank you.